Thanks, Deputy Premier. I guess the Premier's gone through the key numbers for today. There'll be a lot of interest in the Shepparton case. Essentially, we're treating it as a positive. It's turned up as a positive on not a point of care test where you get an immediate result, but a rapid result test that's done locally, and that can mean that the regional areas in particular can take all of those public health actions as soon as that result is through. That said, the result has a high CT value. A high CT value can sometimes mean like a weak positive. So we're treating it as a positive. It may end up being a negative, but we're working through that process. The case has been retested. There'll be a formal test that goes to our reference laboratory here in Melbourne. The close contacts are being tested. For those who have a result, they've been negative, but there are also some pending results for those close contacts. So we respond with some urgency, as we do for any case, but in particular in regional Victoria. But all I'd say is it's not a definitive positive at this stage. We're treating it as a positive. We need to do that, but all of the public health actions are in place in terms of isolating that case and managing those close contacts as close contacts would normally be managed. In terms of the numbers overall, obviously, we're still trending in the right direction. There are a number of our daily cases that are linked to outbreaks, such as the Chadstone outbreak. We need to consider that we can knock off those cases when those outbreaks come under control. So that's a really important part of getting down to the 5 per day average. The baseline number also has mystery cases, so cases of unknown source, and the odd aged care case. They're really only in single figures already, so that's encouraging. 1, maybe 2 sporadic or mystery cases per day, and 1 or 2 aged care cases per day now. So that's a really good trend. The total number, as the Premier spoke to, of healthcare worker cases has come down by another 3. That's 15 aged care staff, 13 nursing staff and 1 medical practitioner in that total. So that is trending down slowly as well. Whether we get to exactly 5 on the 18th or 19th of October is obviously still to be determined. There is that 14-day period that needs to be taken into consideration. But getting there will happen through the control of those outbreaks and the continued trend down for those other sporadic cases and for the aged care cases in particular. But they are also moving slowly but surely in the right direction.
How many of those new cases are linked to the Chadstone outbreak?
So Chadstone outbreak now has 24 cases. There's 1 new case that's been added to that cluster, but there are additional linked cases there. So the composition of that 24 is 7 staff, 9 family and household members, and 3 customers of the Butcher Club.
How's the average tracking? Is that likely to come down a fair way when 27 drops off tomorrow?
Yeah, you'd expect it to, but we also need to make sure that these ongoing outbreaks don't have significant further cases. The Chadstone outbreak, again, speaks to the complexity of the outbreaks that we deal with here in Victoria. Very different from our first wave, really quite different from other jurisdictions, and we shouldn't make simple comparisons of, oh, you've got 5 cases to follow up today, or you've got 10 cases to follow up today, and that should be straightforward. Almost every single case, community case, has complexities across workplaces, households, and the like that we never faced in the first wave. The Chadstone outbreak, again, across workplaces, across households, household members, across other workplaces and into regional Victoria, they are all tricky to manage, but they're all being followed up with great urgency and real skill.
So what are the other 5 cases? Sorry, you said 7 staff, 9 family, 3 customers. That gets us to 19. What are the other 5 cases?
I'm not sure what the composition of those additional linked cases are at the moment.
And do we know where how it transferred to the customers?
Well, there were infectious staff. The interactions probably would have been less than what we would call a close contact for customers. But again, you can get individuals who are very infectious, and you can be unlucky in that interaction, and that's why the call out has been to everyone who was there at that time. That's why it's on the exposure site list, and it has picked up additional cases. They have probably been in face-to-face contact, maybe not at that 1.5 metre distance, but that's not the only opportunity for this virus to transmit. You really decrease the risk of transmission, but if someone's very infectious, if they're symptomatic in particular, or coughing or sneezing or shouting, then the transmission is much more straightforward. So that may well be how it happened.
What will your advice be if we don't hit 5 cases, an average of 5 cases by October 18?
Well, we do have to meet those thresholds. The mystery cases in particular is a really important one to meet. The successful jurisdictions internationally in Australia have gotten to 5 or fewer cases in a 14-day period when they've been able to maintain control into the long term. Places that haven't met that threshold have not been able to do that. So that's an important one. With respect to the 5 average per day, we've always said we need to look at what those cases are. If those outbreak numbers are part of that 14-day average that we get to on the 18th or 19th, we will look at exactly how well that's controlled. Are there further spreads? Are there 100 close contacts who are still in quarantine? We don't know how many of those will become positive. Are there transmissions into really complex settings that we're unsure about? They're questions we'll ask ourselves. So it's absolutely a target, but it does have some consideration of exactly what those cases are and how they're managed.
Would you completely rule out moving to the next stage if we've got more than 5 mystery cases?
No, I wouldn't rule it out. We can have more than 5 mystery cases. We'd have to see exactly where we're at that time, including the trend, because if all 5 of those cases are in the first week of that fortnight, and we have 7 or 8 or 9 days prior to the 19th that has absolutely no mystery cases, that's a posive, obviously.
What's your gut feeling? Is your gut feeling that we're going to get there?
Oh, my gut feeling is it'll be a line ball. Look, it's not a certain one way or the other.
If we do get there, will your advice be to lift the 5 kilometre rule?
Oh, we explore all of those things at the point that we get there. We're not jumping to conclusions about...
Would there be a health reason to keep it?
Yeah, there are absolutely health reasons to keep it. There's been commentary about the fact that people work beyond 5 kilometres, people have reasons to travel beyond 5 kilometres that are part of the complexity of our outbreaks, like the Chadstone outbreak at the moment. But there are also household movements that happen within the 5 kilometres around the restrictions that are in place. We know that having that 5 kilometre in public health directions is a really strong message about where you can move to, and we need to have that as a consideration going forward. But of course it's open to change, it's open to being dropped, it's open to being extended, but we have to come to that when we're closer to the date.
Do you think it's fair that it should be dropped in 2 weeks?
I don't know where we'll be in 2 weeks, so I can't say.
With the new Chadstone cases, were they already quarantining? Do you expect the outbreak to grow even further?
The great majority of people who were identified were quarantining. I hope that some of the additional customers were quarantining, but they were casual contacts, so they weren't they wouldn't have been identified as close contacts. We don't know everyone who might have turned up to that setting. Obviously, we've encouraged people through the testing sites at Chadstone to get tested, so some of them might have been found through that process. I'm not sure if each and every one of them were isolating at home, but you hope so. The message has always been, if you've got symptoms, and people who are testing at Chadstone should have had symptoms, should have been going straight home and isolating until they get that result.
Is there any other?
Would you recommend casual contact? Would you recommend casual contacts to also, isolate? Would the Department of Health and Human Services be following up with casual contacts instead?
So when we list our exposure sites, it's effectively what we're saying. We're saying, you mightn't have had 2 hours in the same room, you mightn't have had 15 minutes of face-to-face contact, but if you've been to this exposure site during this period of time on this date, then we're really prompting you to get tested, and as is the case for everyone, we're saying isolate if you've got symptoms at any time. Absolutely stay at home until you get that test result. So effectively, that's what we're doing.
Are there any
And
additions to the exposure sites?
There are some additions. They'll be on the DHHS website. But I can tell you that for an exposure date of the 26th of September, Leo Fine Food and Wine Supermarket with a time from 12 till 2:20. This is on Summerhill Road in Glen Iris, is an additional exposure site. On the 25th of September, Aldi West Footscray between 12 and 12:15. That's on Ashley Street in West Footscray, Maribyrnong, is another one. And on the 30th of September, White Line Tyres between 12 and 3 p.m. That's in Carrier Street in Benalla. So they're 3 new public exposure sites. There's an addition.
That one's on the Shepparton case.
Yes.
Is the case linked to Chad?
Oh, sorry. It's linked to the Chadstone outbreak.
Right. So was it the Mitchell Shire one?
That's correct.
Right.
And is the Shep case linked to Chadstone?
No, the Shepparton case has no linkages that we've identified at the moment. Look, that's probably another pointer to it potentially ending up being a negative case.
And how has the Chadstone case been able to, I guess, spread its tentacles so far, not just across the southeast, but obviously into the Mitchell Shire?
It really does relate to the fact that any worker has family members. They can transmit to those family members when symptomatic, but also before they're symptomatic. Those family members are in essential work industries as well. They go to those work sites. Those workers, you would hope, are all wearing masks, but again, to the degree that compliance isn't in place or that people drop their guard, then there can be transmission within workplaces as well. Those workplace colleagues have household and family members as well, and on it goes. So it's really, really critical to understand that even as you've got really strict constraints in place, that there can be transmission through the households that are normally constituted in all the workplaces where people come together.
Just on that Mitchell Shire case, the Kilmore Cafe, Oddfellows Cafe that you listed as an exposure site, they posted on Facebook either last night or early this morning that the Kilmore case wasn't someone who lived in Kilmore, that they were a metropolitan Melbourne resident. They were passing through Kilmore and they dined at their restaurant. It's obviously illegal or unlawful for Melbourne residents to dine in regional cafes. Do you know anything more about that?
I don't know anything more about it, no, but you're right. Anyone who's coming from Metro Melbourne carries their restrictions with them and should be getting takeaway only.
Was
So
the
it
same
didn't
person?
necessarily leak into regional Victoria because the person was wasn't a Mitchell Shire resident. They were passing through the area and did something unlawful.
They would have had a permitted reason to leave
Yeah.
Metro Melbourne, but I don't
Not
know
to
the
eat in a
further
cafe.
details. Sorry?
Not to eat in a cafe.
Not to eat in a cafe, no.
Yeah.
Do you
And
know-
was it the
do you
same
know why
person
they
who
were-
travelled? Sorry, Samaya. Was it the same person who travelled who travelled and ate at the cafe in Kilmore and then was at the tyre centre in Benalla?
I believe so. I'll just add, there's one mystery case today with an additional postcode, so that's postcode 3046. Glenroy, Hadfield and Oak Park are the suburbs covered by that postcode.
Just on that Kilmore case, do you know where in Melbourne that person lives?
I do,
Yeah.
but I won't say.
Oh, sorry, you won't reveal the postcode or the LGA?
No. I don't want that individual to be potentially identifiable. Obviously, you know, the numbers of people who are in Kilmore and who visit Kilmore is pretty small. Those who are working also, you know, reduces the potential, you know, numbers of people you can think about.
So they were a close contact of someone who contracted the virus through the Chadstone cluster?
That's right.
Yep.
Can you go?
Okay, at the moment, the only social activity we can really do in Melbourne is going to the park or beach for 2 hours. So naturally, that's where most Melburnians have been going, as we've seen this weekend. How is it safer to have thousands of people spread out across the park but using the same public bathrooms, which is unsupervised, rather than having, say, 20 people outside at a restaurant, which is supervised, and they can control who enters?
So the volumes of people who are coming together and the times are constrained at the moment because it's only for the purpose of social and exercise. At the point where we're happy that millions of people, literally every day, can go out for a much more extended period of time, we'll allow that to happen. We need to get to a point in the epidemiology where that doesn't make an aggregate risk that would drive numbers up. So yes, on an individual basis, whether you're sitting in a park having a picnic with your masks on, or in an outdoor setting of a restaurant, the individual risk is probably the same, but the aggregate risk, there are literally millions of people who would normally go to a hospitality setting in normal times. We have to consider that aggregate risk in terms of transmission in Metro Melbourne at this time.
But that's a setting that could be controlled.
It is, and it will absolutely be a consideration as we allow people to dine again, as we've done in regional Victoria.
There was a case of a funeral up near the border, a small town, wanted to gather. They've had no cases there, and they were planning to sit in their cars around the oval to sort of try to maintain social distancing, but the police came and said that wasn't going to be allowed. It's caused a fair bit of distress for the community up there. Should there be a degree of discretion allowed in some of those circumstances, I guess particularly in regional Victoria where they haven't had any cases and they've still been subject to these quite tough restrictions?
I mean, the evidence on funerals and weddings is that they've been drivers of significant clusters and outbreaks internationally. It takes one case to be there. The areas that believe they have no cases might not have zero cases. That's obviously an issue. The public health directions put limits on funerals for that very reason, but it would be for Victoria Police to speak to the specifics of how they've managed that. But we do have to consider what it means to introduce a single case into a setting that we know is a high risk of transmission.
We're at a different stage of the pandemic right now than we were at the start of the second wave or even the first wave. And in terms of, contact tracing, I guess how else are you looking to improve it other than the swift responses? I guess would you sort of err on the side of caution and shut down a business or facility suspected of maybe potentially being an exposure site and going to secondary and tertiary contact much sooner?
In a sense, that's happening. So there are new workplace obligations in the public health directions that mean that people who are suspected of having coronavirus, so just symptomatic essentially, there is an OC health and safety obligation on the employer to make sure that they're not attending that site. So in effect, that's managing a suspected case. I wouldn't go so far as to shut down every place that has someone with a runny nose or a cough. That would be excessive and disproportionate, but there are obligations to make sure that symptomatic people aren't in the workplace, and that's really important, both from an employer and an employee point of view. When we're listing exposure sites and saying people who are casual contacts, in a way that's also going to contacts of contacts, if you like. Some people who might normally not be considered close contacts, just casual contacts, are contacts of contacts. Their other family members might be the close contacts. They are not close contacts, but we're telling everyone to test. We're asking those symptomatic people to isolate as well.
You've consistently said that part of, you look at the case numbers obviously, but you also look at the story behind the data and the story behind the case numbers. What has it revealed about transmission and also about the pandemic in Victoria in the last week or two? Look,
I think I've alluded to it. It's really that the individual cases that we're seeing now at a community level have enormous complexity to them. It is a reflection of the socio-demographic features of those communities. There are really difficult circumstances that people are in. There are networks and connections that people have across workplaces and households that have enormous complexity, and there are really significant supports to enable people to test, to isolate, to quarantine that we need to step in with and that we need to understand at a local level. And the local public health units are a really critical part of that transition, understanding what the barriers and enablers are to help people do what they need to do. And to make sure that all of the information that is required to manage those really complex circumstances are investigated and understood.
And are you able to walk us through how the 5 kilometre rule sort of prevents the transmission or the spread of the virus, particularly if we're seeing like workplace transmission still, which is a huge feature of the pandemic?
Yeah, clearly working across Metro Melbourne beyond the 5 kilometres is not affected by the 5 kilometre restrictions. The message and the public health restriction that the 5 kilometre rule brings into place means that people aren't going to, potentially going to households beyond 5 kilometres. Now, obviously, we're saying there is no household bubble that is in place yet in Metro Melbourne. People can meet outside within that 5K area, but that is still an interaction between households that is limited by that 5 kilometres. They are new contacts of people. It's limited. We're going by increments, but it is constrained by that 5 kilometres. There are only so many households that you can interact with newly that'll be within 5K of both of those individuals. If one were to open that up to the whole of Metro Melbourne, I can see people moving right across for that outdoor household gathering. But we also have to bear in mind what it means, and it's been very challenging. People have been away from their families, from their loved ones for weeks and weeks, for months. And we have to bear in mind what it would mean for compliance as well, and whether it would open slather, mean that people go to households across Metro Melbourne in that space where masks are not worn, where people have close interaction, where they're talking and laughing, and that those are transmission settings.
What are some of the issues with someone visiting, when there is open slather, or when they do visit someone from the other side of Metro Melbourne?
Sorry, say again?
What are some of the issues of someone in Broadmeadows visiting someone in Bryden, for example?
I mean, the issue is that we've now got just a dozen local government areas really where cases are active. Movement across the whole of Metro Melbourne means that you're introducing virus into places that have had no transmission, where potentially the behaviours are different, where the complacency about having had no cases for weeks on end means that there could be really explosive transmission again. And the issues of introducing it into new settings across Metro Melbourne. We are literally shrinking it down incrementally, where we're not seeing that postcode to postcode movement of new cases. So I accept the limitations of the 5K rule. Essential work doesn't get constrained by it, but I think it's constraining some of the transmission by virtue of where you can meet someone in an outdoor setting.
And is that because you still believe there are a lot more cases in the community than is coming up in test results or in data?
I think we're capturing the majority, but clearly not all. We know that on bigger testing days we're finding more positive cases. That's an indication that there are some people who are not testing on a weekend who are cases, and we really need to make sure that everyone is coming forward for test whenever they're symptomatic.
So on balance, is the 5K rule going to stay in 2 weeks or not?
I don't know. I honestly don't know. We will examine it at the point that we're there. We'll see where, the outbreaks transmission is coming from, and reflect on the 5K rule with respect to that, and the overall picture.
Is there a chance it could be widened out to a 10K rule?
I wouldn't exclude anything. I don't think we're going at all in a direction that would make it tougher. But going out to 10K is it's a consideration amongst all options.
Do you mind if I ask, whose idea was it to introduce the 5 kilometre rule?
Look, it was all part of the public health advice to Cabinet. These are all considerations that are made collectively, but the public health advice was there for the 5K rule.
And is there any data and science to prove that it's, I suppose, it's responsible for limiting transmission?
It's very hard to tease apart the individual interventions that are part of a really substantial package that has transformed the transmission through this wave. To go from 725 cases to single figures has been a success, but to take out each and every element and understand what its contribution is a tricky process. All we can say is that as a package, it's clearly been successful. As a 5K rule, it's in the mix with what jurisdictions have done internationally. there have been jurisdictions that have had a 100-metre limit to leaving your house or a 150-metre limit to leaving your house. I don't think that's proportionate, and I don't think that really changes the dynamics of transmission, but I think the 5K has absolutely shown itself in terms of how we've seen that shrinkage by postcode without really significant reintroduction into new postcodes that are adjacent.
The likelihood of Melburnians being able to go to regional Victoria for bushfire prep from October 19?
Oh, there'll have to be bushfire prep in advance of the season. That's being worked on at the moment, and the communications and allowances for that are being worked through.
Just going back to that Kilmore-Benalla, the person who visited Kilmore and Benalla, you said that they would have had a permitted reason. Do you know that they definitely did have?
Yeah, I do.
Yep.
Yeah.
Premier, could we...
Sorry, can I just ask
right.
Professor Saddam a question?
Yep.
From my colleagues' kids, can they go trick-or-treating?
That's end October, right? If I'm correct. Look, that's a date that's an eternity away, but it's certainly one where I would expect that we've got much freer opportunity to move around. So fingers crossed that your kids and my kids and everyone else's kids can get out a little bit.
Premier. Premier, did you get your wish list from the federal government in terms?
Certainly, we recognise what an impost it is for those individuals and how important it is for their physical and psychological health that they have opportunities to see people with an active outbreak, and that begins with a single case in an aged care facility. And it's really important to have those control measures in place, because we've seen 200 or more staff and residents become infected, and we've seen 1 in 3 residents die with outbreaks. So you absolutely have to control the cases, and the rights that you are sustaining is the right to life for those individuals. But the impact on being isolated in your room is very significant, and I've certainly asked my public health team to work through how they can be more nuanced, if you like, about the individual circumstances for people who are regarded as close contacts and are being directed to minimise their movement, to be facilitated to do things that are really important for their well-being. And if that means everyone gets in PPE and gets someone into a garden area or moves them to another area away from other residents, away from other staff, and in a safe manner, then I'd love to see that happen. So we'll work through that. But there's no question that you have to maintain the controls that stop these outbreaks from persisting and having additional residents or staff infected. And sometimes that is extremely challenging. We absolutely make a case for movements to be minimised, and every infected person has to stay in their room, but that's only for a period of 10 or 14 days until they're recovered and immune. And
someone who's been in there for 50 days.
Yeah, look, that is an extremely long time, and I would love to see an approach that says, well, if you're in a wing that hasn't had cases, if you can be managed from a behavioural perspective and with staff attending to you, to get out of your room, to get fresh air and to move around for your health, that should happen.
The Northern
Sorry, could I just ask just one? But it's on schools. With kids going back to school, would you prefer if they didn't use public transport to get there? If mum and dad can drop them off, or if they can walk instead, would you prefer that?
Oh, look, I think it's a judgment for those families. There'll be some lines where public transport gets pretty crowded, but if you can be in those little 4-seated areas, maybe with your group of friends from your class that you would normally be socially interacting with, then that's probably not an issue. If it's a packed public transport setting and you can't distance appropriately and you've got the option to be driven, then I think that's a reasonable one as well. And obviously walking and cycling and all of those things are absolutely fantastic. So I think it's for judgments to be made by individual families, with the general principle that if you're amongst a group that you're normally in close contact with, that's not a risk. But if you're packed like sardines, then you might want to look at other options.
The Northern Territory will be opening its borders to regional Victoria soon. Do you think other states should be doing the same?
I think they'll come to their judgments when they feel it's appropriate for them, and every jurisdiction will have its own threshold for what they regard as reasonable. But there's no question that regional Victoria is at a point where, we're down to 3 active cases, and it'll be fewer and fewer over time, fingers crossed. So, you know, it would be a very reasonable judgment to say that the risk in regional Victoria going interstate is negligible.
One for Minister Molino, please. Things like